Hookworms versus roundworms versus whipworms in dogs. Are you curious about the differences between hookworms, roundworms, and whipworms in dogs? Understanding these parasites is essential for keeping your furry friend healthy. Let's break it down. First, hookworms are small and thin. They attach to the lining of the small intestine and feed on your dog's blood. This can lead to anemia, especially in puppies or dogs with heavy infestations. Hookworms can enter a dog's body through ingestion of larvae or by penetrating the skin. They can also be passed from mother to puppies through the placenta or milk. These larvae can survive in the environment for several weeks, making contaminated areas a risk for infection. Signs of hookworm infection include diarrhea, weakness, pale gums, and weight loss. Diagnosis is done through fecal flotation to detect eggs. Treatment involves deworming medications, and prevention includes routine deworming and minimizing exposure to contaminated soil. Next up are roundworms. These are larger, resembling spaghetti, and live in the small intestine. Roundworms are one of the most common intestinal parasites in dogs, particularly in puppies. They can cause poor growth, a pot-bellied appearance, vomiting, and diarrhea. Puppies often get roundworms from their mother before birth or through her milk. The eggs are tough and can remain infectious in the environment for years. Diagnosis is made through fecal examination, and treatment includes deworming. Preventive care focuses on early and routine deworming, especially for young dogs. Now let's talk about whipworms. These are smaller and have a whip-like shape. They embed their narrow heads into the lining of the large intestine. Whipworms also feed on blood but usually cause less anemia than hookworms. Dogs get whipworms by ingesting eggs from contaminated soil, often through self-grooming. The eggs are very hardy and can survive in the environment for up to 5 years. Signs of whipworm infection include chronic bloody diarrhea and weight loss. Diagnosis is done by detecting eggs in stool samples, and treatment requires specific dewormers. Prevention involves regular fecal checks and maintaining good hygiene to reduce soil contamination. To summarize the differences, hookworms and roundworms live in the small intestine, while whipworms resided in the large intestine. Hookworms and whipworms suck blood, while roundworms absorb nutrients. All three can be transmitted through contaminated soil, but hookworms and roundworms can also infect puppies through their mother. Roundworm eggs can remain infectious for years, whipworm eggs can survive up to 5 years, and hookworm larvae survive 4 weeks. Preventative measures are key. Regular veterinary care should include fecal examinations and tailored deworming protocols based on your dog's risk factors. Reducing exposure to contaminated soil and promptly removing feces can lower the risk of infection. Many heartworm preventives also protect against certain intestinal worms, including hookworms and roundworms, but whipworm prevention may require additional treatments. Early intervention is essential to avoid serious health issues related to these parasites. Understanding these differences helps ensure your dog remains healthy and happy.